Welcome to Dakota Preparedness. In this video, we're going to talk about what are the essential pieces of gear and information you need to take to the healthcare system. And this would be for an overnight stay, for an emergency room visit, a walk-in clinic visit, or even the dentist office. Now, this was inspired by a social media group that I belong to, that the question was asked about what you should take. And after we completed the dialogue thread, it was quite informative, so I decided to do this video. Now, as background, I should explain that as my fourth career, I was a registered nurse and worked for 6 years in 2 different hospitals. And I think you'll find this information very helpful and will improve the quality of your next visit to accessing the healthcare system. Now, the first thing that you should have if you access the healthcare system is healthcare insurance or dental insurance. It's vitally important that you have it. By spreading out the cost as an insurance payment and with a group rate, you can get an economical rate where if you go in to self-paid, it can be just seemingly astronomical, the cost. So have health insurance. In many states, for children, it's free or virtually free. You just have to get the child registered. Now, if you are unable to obtain health insurance and you are self-paid, always ask for a discount. It can be incredible, the discounts that they will give you on what you actually will have to pay. Now, the second major thing that you should bring is on your iPhone. I highly recommend an app called ICE, ICE, which stands for In Case of Emergency. And I have it downloaded on my iPhone, and I have the standard version. So it has some fairly simple and straightforward information, but it is absolutely essential. Of course, it's going to have your name, your address, your blood type, although my experience is they always test in the hospital for your blood type and also what type of antigens that your blood has unique as characteristics, your date of birth, what sex you are, also emergency contacts, names and phone numbers, what major health conditions you have, and then it lists off the medication that you currently on. Now this includes everything: prescriptions, over the counter, any herbal medicines you have, and list them in detail. Take the prescription bottle and actually type from it into the ICE application. For example, metformin ER, which stands for extended release, 500 milligram, 2 tablets by mouth twice daily. Have such an entry for every medication you are on. And when you go to the healthcare system and the nurse asks what medications you're on, just hand them your iPhone. They will be delighted. Now, the next thing is to list any allergies, not only allergies to medications, but any allergies. For example, I'm allergic to bleach. The last dermatologist I saw for a bleach outbreak told me not to even walk down the aisle of a grocery store where they store bleach. So list any allergy that you have. The nursing staff will want to know this. Your doctor will want to know it. Also, in this app, you could list your insurance information and any other information. And so what would be included in any other? Well, are there any implanted devices in your body? One key one is pacemakers. When you get the pacemaker, they should give you a card letting you know a customer service contact number, the type of pacemaker you've got, and you should Xerox that document, put a copy in the glove compartment of every car you have, put it in your wallet or purse, and if you end up at the healthcare system of whatever type, make sure they have that information. Nowadays, for example, the pacemakers are extremely sophisticated. They have memories, they can be remotely accessed, and it provides just a plethora of information that's vital to your healthcare provider. And I would extend this also to any other sort of implanted device, an insulin pump, a painkiller highball pump, also any metal in your body. It is quite interesting how many people have metal in their bodies. Everything from shrapnel from the last war or previous war to bullets in their body. And sometimes it's not from war, it's from someone shooting them. And for whatever reason, they left the bullet there. So have all of that listed. It's particularly important as if you get an MRI diagnostic picture taken of your body. Now, if you can't download the ICE application onto your cell phone, then simply the information that I just outlined, write it down on a piece of paper and carry it in your wallet. And when you access the medical care system, when they ask you what drugs you're on, then simply hand them the list of what you are currently taking as a prescription, an over-the-counter, or a herbal medicine. And also, I would strongly advocate that you be totally honest with your healthcare provider. If you have some illicit, illegal drugs in your blood system at the time that you come to see them, tell them about it, so the doctor can factor that in to interactions with any prescription. The third item that you need is a power of attorney for medical decisions. Find someone that you can trust, who cares for you, who can make tough decisions, who can make rational decisions, and appoint them as a medical power of attorney. This allows them to make decisions for you if you're unconscious, if you're not rational. Now, sometimes included in that document, or sometimes as a separate document, is medical directives. And some key decisions here is, one is, do you want to be coded? If your heart flatlines, do you want the doctors and the nurses to come in with a crash cart and use an automatic electronic defibrillator and high-end cardiac drugs to bring you back to a regular heartbeat or something that sustains life? I recall one time while we were coding a patient who was, the directive was to code them, the two sisters of the patient were outside arguing. One was arguing for no, they shouldn't revive her, and the other one was arguing that they should use every medical device and technique possible to bring them back. Well, the code had started, and this was no time to have that discussion. It should have been before, and it should have been with the patient. And ultimately, the patient should be the one that has the final say. Another key thing that you'll want to have in your medical directives is, do you want to be intubated? This is where they put a tube down your throat, and a machine, in effect, breathes for you. Now, this can be a lifesaver, and in many cases, it's just a miracle, and you can recover from being intubated. However, sometimes there will not be a good outcome, and if a person, it's all individual, but if a person is just absolutely ancient, they've been struggling with health problems for a long time, and sometimes it's better to make a good go than a bad stay, they may elect to not be intubated. There's a third decision, where when end of life is finally come and the family and the patient accepts it, called comfort measures only. Now, this doesn't mean don't treat. You're going to make the patient comfortable. The doctor's going to prescribe oxygen and pain medicine as required, but that's another typical decision point. Now, you can include all sorts of things in your medical directives. I remember one time we had a patient who was a retired registered nurse, and she listed all sorts of things that she didn't want her to be inflicted or applied to her. So, in recap, have health insurance or dental insurance. Get the ICE in case of emergency information documented in the cell phone app or as a written down document. Have a medical power of attorney with the trusted individual. And finally, have medical directives. Now, as far as the power of attorney for medical and medical directives, most hospitals will have a form that they will provide to you, even if you just come up to the reception desk and ask for it. And you go home, you fill it out. And then you can come back and have it properly witnessed or notarized. And also, at least at my local hospital, you can come down as a non-patient and just ask for your power of attorney or medical directives to be scanned in, and then they'll have it on hand. So these are key documents that will make your visit far more smooth and allow you to think through these critical areas before the emergency. Now, if you are going to the emergency room and have the potential that you might stay for an overnight visit, there are some key things that you should take. Now, as a general principle, what I'd say is take as little as possible. You may be moved multiple times from room to room. It just clutters up the room. In my 6 years, never knew of a case where anything was stolen, but I was told by other nurses that they knew of such cases where patients had come up missing valuables. So, as a general rule, take as little as possible and don't take valuables to the hospital. Now, I get you want to take your wedding ring there. I understand that. But don't be bringing a whole bunch of bling. Your earrings, your golden necklaces, your bracelets. No, just leave those at home. Now, I have seen some incredible things brought to the hospital. One time we had a patient bring 2 cans of beer. Well, alcohol doesn't mix with some prescription drugs, so we had to confiscate the beer and stored it at the nursing station until they were discharged. In another case, a woman told me she had a little bit of money. When I looked into the bag, I instantly realized, having another career was as a certified public accountant, there was $20,000 there. So very quickly I got a nurse's aide, and the 3 of us counted the money, sealed it in a property bag. I called the nursing supervisor, and they stored it in the hospital safe until she was discharged. So don't be bringing that type of money to a hospital. There's just too many opportunities that it could go missing. All right, what are some of the things you should take? Well, a lot of people will want to take a house robe. You know, the typical hospital gown is actually designed to be extremely functional, but it also will show your backside. So some people, they want to bring a robe, and that's certainly appropriate. Number 2 is some people will want to bring slippers. Now, at the 2 hospitals I worked at, they had some incredible non-slip socks, and they had little rubber knobs on the sole of the foot, and they were extremely comfortable. So that's the type of slipper you should have, a non-slip one, or just use the hospital's non-slip socks. Certainly don't bring your bunny ear slippers that you can skate around the room with. The hospital is very concerned that you would fall and further injure yourself, so have good solid footwear when you're in the hospital. Number 3 is do bring your dentures. Now, I have had patients that didn't want to bother with their dentures while they were in the hospital, and that's fine. But if you bring your dentures, then bring your own cleaning supplies. And also a little suggestion, put it in the drawer of the nightstand so that in the middle of the night yourself or a nurse knocks it off the top of the nightstand and it falls on the floor. I don't know of any case where that's ever happened, but it is a potential. Also, certainly bring your reading glasses. Bring your contact book with phone numbers of friends or people that you might want to talk to while you're in the hospital. Now, number 6 is you might want to bring some games. Now, what do I mean by that? Well, I've seen some patients that do crossword puzzles, and they just love doing that. And they'll have a little magazine type book for that. So that'd be an example of an appropriate game to bring. Another thing is, certainly nowadays people want to take their cell phone with them, and it's vital. Bring your charger with you. I've had so many patients had their phone go dead, and we had no charger that would fit their device. So make sure you have the charger. Now, some people bring tablet computers or laptop computers. I've been retired for a number of years now, but I was so amazed that one of my patients was on a laptop talking to their son in the Middle East while they were in the military. Another item that seems to occasionally be popular is bring a music player, and certainly bring some earplugs so you're not sharing your music with everybody in the hospital. Another popular thing is to bring some books or magazines if you read those. Now, a couple other additional items is certainly have clothing that you can leave the hospital in. Now, number 12, and I'm going to speak from both sides of my mouth on this. As a general statement, don't bring any actual drugs. The hospital has their own drugs. They want to control the quality and the amount that you're receiving. However, there are a few exceptions. Sometimes patients are absolutely adamant that they want their certain type of herbal medicine or over-the-counter medicine. And then an additional area that I would say is sometimes some drugs, prescription drugs, are very hard to get a hold of. The hospital will have a very hard time getting a hold of them. So I have one drug that when I call the local pharmacy to replenish it, it always takes a lead time of 3 or 4 days because it's a fairly rarely used prescription drug. Now, you could have something similar, and I've noticed it particularly when people have had transplants, a heart transplant or a lung transplant. They will be on certain suppressive drugs that the hospital may not normally carry. So you will want to bring in those rare types of drugs, and the hospital will want you to turn them over. They'll store them in the hospital pharmacy for you. The hospital pharmacist will dose out the drugs for you with the nursing staff administering it, and when you're discharged, you will certainly get your medicine back. Now, some interesting things I have seen patients bring in, which it seemed to be very advantageous for them. One was a sleeping mask that they placed over their eyes so that they could sleep at night. Another thing was like headphones that went over their ears. They could block out the noise of the hospital. Now, as a general statement, I would say don't bring any snacks. Often the doctors want to control your diet for the medications you're under, and the hospital will feed you. As a matter of fact, most of them have very good food. No, it's not mama's cooking, but it's pretty good. Another thing is various cosmetic or a toothbrush, a comb, toothpaste. The hospital has all of those things and will provide it to you. Now, I certainly can understand that my wife would want her comb, her brush, so she keeps an overnight bag in her car for the explicit purpose of going to the hospital. Now, I will once again will reiterate, and maybe this is a man thing, maybe because I'm ex-military, but I go back to the general guiding principle should be take as little as possible. Don't take things that are of value that you would be very upset with if they were lost or stolen, which once again in my 6 years experience as a registered nurse, I did not know of any cases of those. I did have a number of cases where after a patient was discharged, they would call us and they had left their favorite book, in the room, and we would have to run in there and see if we could find it or call the cleaning staff and see that they had it. So that brings up a good point. Whatever you take to the hospital, make sure you take home. So I hope you have found this information helpful. If so, please click like and subscribe. It helps the channel and it helps the community. Be prepared.